Session of today before we break for I think a very well-deserved break, and I think for many of us some food and a drink will be very warmly received. This is the session where we are feeding back to you the recommendations from the work that has taken place over the first two-thirds of today in the Staying Healthy theme, the first theme of the 5 themes across the 3-day meeting. And what we're wanting to take you through, hopefully just quite briefly, is an overview of the process which will be undertaken with each of the 5 themes following, including the virtual process for recommendations, and then we will be hearing the specifics of the recommendations themselves, and then will be an opportunity not for discussion but for affirmation that these recommendations are consistent with the discussions that you had in your own groups. Up on stage, I'm joined by 5 members of the team who have been each working incredibly hard over the course of today in formulating these recommendations that are being shared with you. Sammy Kissy is here. I just think it's such a great name. Imagine having Kissy as a surname. I'm very envious. Who is on the steering committee, who is taking us through the overview of process. Amanda Kiefer is to his left, who has been overseeing the virtual process. Ishta Chaudhry in the greeny blue will be presenting the findings, and then Soha Abdulati and Lindsay Menard Freeman, also members as facilitators of groups who are also available. So Sammy, over to you in terms of process. Thank you.
Thank you very much, Susan. So my task here is very simple. I'm just going to wait a second to see if the presentation will come up. Thank you very much, and apologies for that slight technical hitch. So, hello, can you all hear me? All right, so my task is very simple. As you know, we have successfully completed 2 World Cafe sessions. The first one on staying healthy and the second one on comprehensive education. Now, we have finished with the process of consolidating all the outcomes of the staying healthy theme. And I'm going to be explaining how this process was, and this is going to be the process for the subsequent themes that we'll be having. So, as you probably know by now, we have about 14 to 15 World Cafe sessions. Each of these sessions are moderated by a facilitator, and you have a rapporteur in these sessions who will be coming out from those discussions you'll be having with your 3 main recommendations moving forward. So the outcomes from all these World Cafe sessions will be sent to the outcomes room. Now, in the outcomes room is what we are calling the outcomes group. And the group is constituted in such a way that it is open, transparent, and representative of all the young people who are participating and all the delegates who are participating in the Global Youth Forum. So, There is representation from the Secretariat, which is the UNFPA, as well as some technical advisors who are helping to guide this process. We also have representation from the Steering Committee, particularly the Outcomes Task Force of the Steering Committee. Rishita, who is the co-chair, one of the co-chairs, is going to be a permanent member of the Outcomes Group, as well as myself, in my capacity as a member of the Outcomes Task Force. Now, for every theme, there will be at least 3 members of the Outcomes Task Force who will join this process to ensure that all the different recommendations from the World Cafe sessions are accurately captured. In addition, we will have representation from the World Cafe sessions themselves. So in this previous one, we had 15 rapporteurs and 15 facilitators from the World Cafe sessions coming together to present what recommendations came out of their groups. So as I said earlier, there were 3 recommendations from each group that are brought into the World Cafe, the Outcomes room. In addition to the team that is there, we also have the virtual rapporteur, and Amanda will be telling us in a little bit what that process is like. And we also had the theme moderator, who in this case was Dr. Susan Sawyer. So this is the team that met, and we have gone through a very lengthy and painstaking but fun process of consolidating all the recommendations that came from the discussions. I know it must have been tough working to have 3 priorities, but believe me, by the end, I am sure you will be happy that all the different discussions you had in your sections were reflected in the outcomes. So, each World Cafe session presented their 3 main recommendations, and these were consolidated in the outcomes room. This is just the process that we're using now, and we hope to use the same process for the subsequent sessions. We will be meeting very shortly as well to do the same for the comprehensive education session. So we have this group of people from all regions, all different interest groups and stakeholders who are going to be working closely to ensure that all the discussions you had in the World Cafe sessions are represented, that all the recommendations are synthesized to reflect the views of everyone. So this briefly sums up the recommendation, and I'm sure very soon we shall be listening to what the recommendations for staying healthy were, and that will be presented by my colleague Ishita. Thank you very much.
Amanda, can I invite you to come and share, or if you're happy to do it from there, share the process in terms of the virtual recommendations, because we know it was a slightly different process to integrate these.
Yeah. Can everybody hear me? Okay. Yeah, so I'm Amanda, and I'm one of the many virtual rapporteurs here. I specifically worked on the Staying Healthy theme. But we had a huge group of people that worked on this. It was a big process, and we were really happy to bring the thoughts and ideas and recommendations from youth around the world through our virtual forum. Just to give you an idea of what this looked like, we have nearly 2,500 youth that have registered as virtual delegates. About 10% of those have submitted recommendations across all the themes so far. For the Staying Healthy theme specifically, 747 virtual delegates declared staying healthy as a key area of interest for them, and 112 recommendations were submitted for the Staying Healthy theme. And what we did is we got together and looked at those recommendations and compiled them in a clear and concise way, starting from 10 p.m. last night, working up until the end of the World Cafe Forum, to make sure that all of those voices were heard. And we brought those virtual recommendations into the outcomes group session, and we were able to really incorporate those ideas. So.
Okay. Over to Ishta Chaudhry now to share with us the detail of the actual recommendations, and I have with you your PowerPoint advancer.
Thank you very much. At the start, I'd just like to say I think a big round of thanks is owed to the 15 facilitators and rapporteurs, and most especially UNFPA and 3 technical advisors we had with us for being so supportive, I think, of the process. Just to share with you a quick overview of where we start. Essentially, they have emerged 5 sets of recommendations that we have prioritized across different themes. So we have one on data, one on enabling environments, one on education, one on access to health services and laws and policies. And as was shared earlier, the way in which we came up with this grouping was to see the most number of times, for example, that a single recommendation was made. So this does represent consensus from what was emerging in the groups. And I'm going to take you through each one. So the overview that was put together as part of this process was on ensuring accountability, transparency, and the need for implementation as a cross-cutting theme across all recommendations, with special focus particularly on LGBTQI, MSM, drug users, refugees, rural populations, out-of-school, sex workers, indigenous, Afro-descendant populations, migrants, young people in conflict and emergency situations, empowering young women and adolescent girls, persons with disabilities, and young people living with HIV and AIDS. I apologize if you find grammatical errors in here. We kind of rushed straight, but just to say that the focus on these populations and these groups of young people was seen as key to all the recommendations that I'm about to share with you. The first one was on data, and it said that governments should develop and strengthen multi-stakeholder partnerships with private sector, civil society, and young people in collecting, analyzing, using, and disseminating periodic, reliable, qualitative, and quantitative output in outcomes-oriented youth health data, which is disaggregated by age, 10 to 14, 15 to 19, 20 to 25, gender, sex, and other factors, and supports evidence-based policies and programs. So that was the first collective recommendation. The second was to invest in building the capacity, as in governments should invest in building the capacity of young people to collect and validate data, ensuring youth-led and youth-friendly monitoring and evaluation mechanisms in the design, planning, and implementation of national policies and programs. That makes me feel a lot better. The second was on the theme of enabling environments. The first recommendation was governments should work in partnership with adolescents and youth, media, religious leaders, and the private sector to create enabling environments that are conducive to ensuring young people have access to comprehensive, affordable health services that are free from coercion, discrimination, violence, and stigma, and provide for basic needs through increased funding, improved legislation and policies, accessible and affordable services. The second was that governments should also ensure that young people have meaningful participation in the allocation of resources for health at the local and national levels, and that the creation of policies should respect, protect, and fulfill human rights. The third, governments should address harmful traditional practices such as forced circumcision and genital mutilation, early and forced marriage, gender-based violence, and violence against women. And the last, state and/or local authorities should provide young people with access to safe spaces, including outdoors, for physical activity. And these are the set of what we had for enabling environments. It's being moody. The third was in education. The first recommendation was that the international community, including governments, NGOs, private sector, and civil society, must establish partnerships to make adolescents and youth aware of their rights to staying healthy, both through formal and non-formal education, and that they should provide non-discriminatory, non-judgmental, rights-based, age-appropriate, gender-sensitive health education that includes youth-friendly, evidence-based, comprehensive sexuality education that is also context-specific. That sentence is quite a mouthful. Recommendation number 4 was on the area of access to health services. Governments must provide, monitor, and evaluate universal access to a basic package of youth-friendly health services, including mental health care and sexual and reproductive health services that are high quality, integrated, equitable, comprehensive, affordable, needs and rights-based, accessible, acceptable, confidential, and free of stigma and discrimination for all young people. Second, that as part of this basic package, governments must provide comprehensive sexual and reproductive services that include safe and legal abortion, maternity care, contraception, HIV and STI prevention, care, treatment, and counseling to all young people. Lastly, governments should ensure that all healthcare providers receive training on youth-specific health issues and the provision of adolescent and youth-friendly services through pre-service and in-service training and professional development. And the last relating to laws and policies. Governments and UN agencies, in line with the international human rights standards, should remove legal, policy, and regulatory barriers that hinder the meaningful participation and empowerment of young people to exercise and claim their rights. 2, that they should support the sexual and reproductive rights of young people, including ensuring access to legal and safe abortion that is affordable, accessible, and free from coercion, discrimination, and stigma, providing support and protection mechanisms that promote young people's right to choose. The third, that governments should implement financially sustainable policies and legal frameworks that protect, promote, and fulfill the reproductive and sexual rights of all young people, regardless of their sexual orientation and gender identities. And last, that we call for governments and UN agencies to institutionalize mechanisms for youth leadership, particularly marginalized youth, as per the list that was mentioned to you as part of the overview, in the development of policies and programs that impact young people's lives.
Lindsay and Soha, you are part of this process and are part of the reporting structure. Would you have any other comments that you would wish to make, either in terms of the process that was undertaken or in relationship to any of the specific recommendations? No. Okay. So quite a mouthful in terms of each of those recommendations. Ishta, I think you've done a fabulous job in taking us through them. We are told that these recommendations will be available fairly soon after this session in terms of the ICPD website. So would certainly welcome your opportunity to look at them in more detail. But Sammy, over to you, because my understanding is that there are now some important processes of affirmation that we're needing to formally go through.
Thank you very much, Susan. So I was happy to hear the applause after the reading of each recommendation, and I take it that this is a signal that these recommendations reflect the issues that you discussed. Of course, we had so many people and so many World Cafe sessions that I think you will all understand that it would be impossible to reflect every single decision or every single discussion that was had. But I think we can all agree that these represent the main issues that arose from the discussions we had. If you agree with this, then to signal, I would like you to give a round of applause for all of us who have inputted into this process. Thank you. So, Susan, this means that we have officially finalized the recommendations coming out of the Global Youth Forum for the Staying Healthy theme. Now, we request that if there is any group or any person who feels that some of the issues that you raised have been misrepresented or have not been captured adequately, that you get back to us in the outcomes room, and we shall listen to you and take into consideration your concerns. So I'm sorry, just as I explained, I know that we've had extensive discussions. These have been the result of extensive discussions, and we cannot open it up at this point to discussions. If you have any concerns, I do request that these concerns be made available to us. Thank you very much, and I'll hand over to you now, Susan.
Thank you. That formally ends the session. And I would also like to let the people involved in the education recommendations know that they are invited to the outcomes group, because immediately after this they will be going through the same process and developing recommendations. My apologies, there has been a formal process we have gone through. My apologies, as Sammy explained, if there are individuals who don't agree with any of the recommendations, we would invite you to join with Sammy as the leader of this process later, probably won't be able to be this evening, who has said very clearly that he would be very pleased to take anyone through the processes and share with you the documentation that was gone through. And I understand that you're unhappy with the process. Can I just reiterate that as an outsider participating in this, I have been remarkably impressed with the processes that were undertaken that were built on consensus. I must say, I think for all of you in the audience who have participated in what I have seen as a very exciting process, I would like to formally thank you for your contribution, seek your ongoing contribution, as I know we are needing over the next 2 days of the meeting. This has been a very exciting end to the first pillar of discussions. The recommendations from the education theme will be presented tomorrow. And I think that now formally ends the processes for the first day of this meeting. Thank you all very much.